Okay.
We're ready, yeah.
All right. Well, welcome everybody. Thank you for joining. We'll get things kicked off, which I think is the more interesting aspect of panels because a lot of attendees tend to join 5 to 10 minutes late. And if you're watching this as a recording, you're normally just skipping over this portion anyways, but we'll remind you what meeting you signed up for and the people that you're interested in seeing anyways, nonetheless, to set the standard and get familiar with each of us and dive in. But this is the panel on the transformation of virtual care. We'll talk to a number of experts from different pockets of the healthcare industry to get their perspectives on the transformation that we're seeing, or really we all saw coming, but that's actually coming to realization over the last year or so. I'll do a quick round of introductions for each of them. We'll keep it brief because we all know that your Google search works quite well and you can pull all of our bios up at any time. But nonetheless, I'll turn it over to each of them momentarily. But I'm Paul Schrumpf. I'm the lead of Profits Healthcare Practice, which is a growth consultancy that focuses on the transformation of organizations, both technologically and digitally, as well as human-oriented transformation, which is a lot of what today's conversation is about with the transformation of virtual care. In addition, for each of everybody's intros, I want to get people's thoughts on the one thing that actually surprised you coming out of last year with the rapid adoption of virtual care. I'll go first. I thought the surprise I saw, given with a lot of questions and panels I sat in last year, was why did it take a pandemic to drive adoption of virtual care? And the most frequent answer was behaviors. We just didn't think about it. We just didn't try it. And it kind of took me back to being a child of the 80s, where I used to get into the car and my parents would put the seatbelt on me and then proceed not to put a seatbelt on themselves. And you forget how much of behavior change is required for new things, that no matter the amount of research or the good idea or how easy it is, behavior change is this fickle beast that takes a little extra inertia once in a while. And I was mostly surprised at that being what people thought was the biggest barrier in adoption of virtual care. It wasn't the reimbursements and the policies. It was, we just were never forced to do it. So that was mine. I'll turn it over to Bree. Quick introduction of yourself and what surprised you.
Yeah, good afternoon. I'm Bree Bush, a principal within our G Healthcare Command Center business. I oversee command centers across the US. I would say the thing that surprised me most was when the providers put their minds to jumping into virtual care, how quickly those IT departments worked. I worked with them quite often. And let's just say it usually takes an act of Congress to get the new IT system in place. And it was astronomically fast how they bought new software, implemented it, had the infrastructure ready, the security ready to go activate that. So that's one thing that surprised me, is just when they put their minds to it, how quickly it can move.
Yeah, I saw that as well. This is the amount of, in 2019, it's like, oh, is that HIPAA compliant? I don't know if we can do that. And then this idea of actually putting patients first actually came to fruition. It's amazing how fast we can move in that space.
Yeah,
and then Shruti, you're our doctor in a panel. I'd love for you to introduce yourself and share what surprised you as a physician.
Yeah, no problem. Thanks for having me. Shruti Singhal, ER doc by training, but over the last few years have transitioned to non-clinical work. And I probably had two major surprises. One, to Bree's point and yours, Paul, I was shocked at how many different medical specialties picked it up. It wasn't just family practice or just pediatrics. It was the surgeons and all, just pretty much anybody that could did. And I think the part that was sort of funny and sort of shocking to me was the text-based virtual care. Who would have thought? I mean, if you would have asked me in 2019, are we going to be texting our doctors questions and, getting care over chat or over text, I would have laughed. I mean, I just would have laughed. And so I think that was probably one of the really big sort of on a personal level surprises for me.
Yeah, it's interesting how virtual care has shifted from this assumed primary care virtual front door to this myriad of subcategories that's come online. And we're actually thinking of like different categories of virtual care now moving forward. Suzanne, great to see you. Hope you're coming through okay.
I hope so too.
Awesome. Well, we're just doing a round of introductions and you'll be rounding us out after Jamie. So Jamie, in addition to not giving up the ship, tell us a little bit about yourself and what surprised you about the pandemic.
Yeah, so Jamie Edwards, CEO and co-founder of Cloudbreak Health. Cloudbreak is a healthcare disparities solutions business that resolves those disparities using telehealth and digital health. implementations. We're in 1,900 hospitals across the country. We do this over 130, 140,000 times a month over what is now a network of 16, 17,000 video endpoints. I think there's a few things that surprised me, and we don't have hours, so I'll try and keep it to just a quick minute. But you mentioned the power of culture change, and it surprised me how quickly we were able to implement these things, and also how quickly we are now backsliding, if you will, into what appears to be people going back to the new, to the old normal as opposed to what a new normal could be. And I think that's a real shame. We have this huge opportunity to transform the healthcare system and to finally catch up to other industries like banking and finance and the retail space, who've all gone through digital transformation, and yet healthcare persists in like this in-person visit as being the gold standard. And what COVID showed us is that the gold standard is whatever the appropriate modality is for that specific chief complaint. And shame on us if we go back to having people drive to the doctor's office to wait for 45 minutes for what's a 15-minute visit. I think we have the opportunity to really plant a flag and move forward as opposed to move back.
Yeah, it's a great call out. Yeah, that's the interesting aspect is building the report that this panel is kind of really based off of. It was a moment in time, and the big question is like, what's going to stay, what's going to go? And I think I wasn't ready for the disappointment on what's going to go, because you forget about that. That's great. Suzanne, would love to get a quick introduction of yourself. And again, same question on top of that, which is what surprised you the most with the rapid adoption of virtual care in the last year?
Okay, great. Thank you, and apologies for being a moment late here. And I hope I continue to come through clear. Just give me a signal if something happens. Right. My name's Suzanne Foster, and I currently am leading the Cardinal Health at-home business, which is essentially all of the supplies needed to treat chronic condition in the home. We orchestrate that and provide about over 50,000 products to the homes in the United States for chronic conditions like diabetes, urology, wound care, incontinence, enteral, all of those types of things. And so, interesting enough, what surprised me was I took on this position back in January of 2020. And I joined this business because I believed that care was shifting to the home at a rapid pace. And I've been fascinated with telehealth and remote patient monitoring and trying to drive more at-home care. But then COVID hit, and oh my, what surprised us was trying to keep up with the demand and the shift. But what was really surprising to me was three things. The pace at which acute hospitals pushed out care. We've been waiting for that to happen for a long time, and it happened literally overnight. The second thing was the regulatory reimbursement environment, how with a stroke of a pen, the administration was able to change payments so that it could happen immediately. And then the third one is just the acceptance of the consumer, of the patients, people like my parents who really never thought they'd find themselves on a telehealth visit. And those three things I kept saying prior to COVID really had to change in order for this adoption to happen. And you saw that happen literally in 30 days.
Yeah, that's awesome. Yeah, I think we've seen a lot of that. A number of great topics came up with. I want to touch on the modality, the backslide, this habit piece. But I think the most logical piece, because it comes up so often, was Bree, what you kicked off with this rapid adjustment and nimbleness of IT, because whether we like it or not, the world of digital experience and IT are always intertwined. And I think healthcare has a bias to put digital on the shoulder of IT. But what were some of the myths and realities, Bree, that you saw in watching some of these, particularly the acute care systems, rapidly shift their IT focus to be more digital, more patient-centered versus policy-centered, so to speak?
Yeah, I think the biggest thing is, this desire to keep everything in the EMR constantly, and that got really difficult for them fast. And not having the ability, the patient experience wasn't linear anymore, right? It wasn't like they're in front of us, we care for them, let's document what we do. And so I think they really saw the gap, and we saw the gap of needing software that helped with track that patient who's, it's a long journey for them. And so how do you surface and make it easy for the care team to see who's at risk, who should we be reaching out to? Because there's all these patients that we're not seeing, we don't have eyes on. So how do you virtually have eyes on them and and surface very quickly. Patient at risk, this one we need to be reaching out to. And so I think the organizations have realized that there's investments beyond the EMR to do this and to do it well. And we saw a lot of that happen through COVID.
Yeah, I think that's a great point, because there is this worldview, a few people have touched on it, is that there's like linear care continuum. There's a start and there's a stop and there's a box and there's a center and a campus. But a lot of that has changed. And I know Shruti, in our earlier conversations, you had a lot to say about the care continuum and what's going on there, but would love to get your thoughts on someone who's up close and seeing this care continuum, if it is a care continuum, and what's happened there.
Well, yeah, exactly. We talked about this and touched on it, where a lot of our encounters were really just that. They were encounters. We saw a patient, we kind of finished, and we moved on. And I think what I hope to see, and I think what we're starting to see, is that we can kind of make that end to end just wider. Let's just make it wider. Let's know more about what's happening before we see the patient. And when we say you're good to go, what's happening afterwards? And it's really gonna help us know that the right people, to Jamie's point, are getting what they need. Not everybody can get virtual care, but not everybody needs the ER, and not everybody needs to be admitted. And how do we prevent readmissions? And how do we prevent waste and overuse of resources? And I think it's all about data and engagement. And I think when we get more of that, we're really going to see a lot of those changes that all of us are speaking of, that we, again, shame on us if we don't take it one step further.
Yeah. Jamie, I'm seeing a lot of head nods.
Yeah, I mean, it's hard to come up with an innovative and creative thing to say when, like, the people in front of you have kind of hit the nail on the head, right?
Mm-hmm.
If you take a look at the broader care continuum, digital health tools can be integrated throughout the entire thing. There's literally thousands of different use cases. And people have this idea, at least during COVID, right? It was like, okay, well, let's get video up. But then they realized the video platform that they had was this single episodic point solution, as opposed to something that really should have been part of a broader platform and a broader digital health strategy for that health system, right? That actually connected these disparate points on the continuum of care into what we would call one acuity funnel. Okay, you start with the digital front door. From there, you can then escalate to that in-person visit as you've started to navigate what are different things you can do. And now we've seen the evolution of companies like Ready Responders and other companies like that are actually deploying people to the home now, right? So when you take a look at this broad care continuum, it could start off digital. You could then deploy someone to the home for an in-person home digitally enabled visit backed up by a telemedicine doctor. And then you can actually move that person now to an in-person visit, maybe in hospital if the acuity demands. And I think when you talk about misses, I mean, clearly disparities were an issue that no healthcare system was really prepared for with their digital health platform. So how many of them were integrating a language interpreter into that call? How many of them realized that the patient that they wanted to do a telemedicine visit with didn't have a tool they could actually do that telemedicine visit on? Those were the types of things where technology sometimes increases that digital divide instead of bridges it. And those are things that still need to be addressed to this day.
Yeah.
Maybe building on that one bit, one of the things that one of the providers shared with me of being so difficult is everyone texting, right? So how do you triage a bunch of unstructured information? Is this patient in crisis? Do they just need, confirmation that their meds are okay? And so they said that's still a major gap, I think, out there, is this communication and it being so fluid. How do we really figure out, again, who's at need, what type of needs they have with all this unstructured data out there? So I think that's another challenge, probably that's continuing the next couple years, probably.
Excellent point. And Suzanne, you made an interesting observation, which is there's a lot of unstructured, the care continuum is not linear, but we also have this interesting perception by your typical patient that the US healthcare system is more monolithic than it is, but the patient doesn't understand or appreciate, nor should we expect them to, the fragmentation that we're actually throwing at them. But we'd love you to kind of expand more on some of that thinking and those observations.
Sure. So what we've been talking about is as care shifts out of the hospital or out of the acute setting into the home, one of the problems with that is the patient's understanding of how healthcare works. So the example I've been using around Cardinal is when a patient walks to the front door of Cleveland Clinic, they're under the assumption that they're being cared for by Cleveland Clinic. And all of us in healthcare know that it's a network or an ecosystem of all these different providers that through the years, our acute healthcare system has become sophisticated and it works for the most part pretty cohesively where the patient doesn't experience the disconnects. And so at Cardinal, what we've been talking about is how do we bring that level of a tech-enabled ecosystem to home care so that when that person either leaves the hospital or they have a virtual hospital admission into their home, that there is a control tower, much like the brick and mortar and EMR infrastructure of an acute setting, into the home where everything shows up orchestrated. Lab work shows up, a nurse visit shows up, even meals show up, whatever it may be. But we're working to build this control tower where we could help through technology orchestrate everything that's needed in at the right time in the home for comprehensive care.
That's great. And when I think of control tower in healthcare, it's hard for me not to think about the command center, Bree, but you've had so much experience of essentially taking EMR data that's largely there to kind of collect and track and record keep and use for claims, but to actually use that for a tool for run a better patient experience, but also a better healthcare professional experience. But we'd love to hear some of the stories that you learned in just getting a continuity inside a care setting that we can be thinking about as we kind of see the decentralization of care and seeing that exponential need grow.
Yeah, I mean, orchestrating care is hard. And when you look at the hospitals, there's a million different silos trying to come together, exactly what Suzanne said. And so what we saw through COVID was a lot of bringing that data together past those silos and trying to orchestrate that, nudge people that PT, it's your turn. Now you dietary, so that they felt completely orchestrated because they couldn't, multidisciplinary rounds weren't happening anymore, right? You didn't want all those people together. So I think this idea of bringing the data out of the EMR, running analytics and helping prioritize for the different care providers, here's what's most important now, here's the patients you should see first, second, and third, is going to be a game changer. They just don't have the resources to be searching for information. It's got to be surfaced. And that's what we really worked on heavily throughout COVID, is getting to that point where simple, smart, fast, here's what needs to be done through the command center work.
Yeah, and I like it because it not only makes a better patient experience, but when done right, it makes a better healthcare professional experience. And I guess, Shruti, this is kind of where I've got some questions for you, because we always tend to think about what the patient's going through. But given that you're so close to the physicians and the healthcare workers and the nurses, what have you been hearing as the adoption of virtual care has been kind of on the surge, and the pros and cons in the medical space?
Well, I think I was going to say, I wrote all these notes from what everybody else was saying. So, I think everybody kind of hit on pieces of it.
Yeah.
Everybody wants it to work, and everybody wants the patient experience to be at the top. And then, of course, all things reimbursement to work, because that's how everything goes around. I would say I think it's a behavior problem again. And I say problem, but I really mean solution. It's as the behaviors change and we start to see, especially in behavioral health, and we haven't hit on that yet on the panel, but especially behavioral health, to me, it's a game changer. If we're going to be able to get behavioral health access to more people, it's actually going to leak out to all of the physicians and the patients in the entire country, because so much of that is leading use and resource use throughout. So I would say on the doctor level, the nurse level, and any of the healthcare workers, I think it's an absolute pro, as long as we're using it, to Jamie's point again, in the right way. The right people are getting virtual, the right people are getting in person. And as we triage that, as Bree said, I think it's going to be a game changer.
Yeah. I think it's an interesting point, and Jamie touched on this also, is it's interesting watching this collision of health equity becoming the new buzzword, and for all the right reasons, and I think we all respect that. And then you see this surge of virtual care, and in many ways, it's two opposing forces. So we're all recognizing the need for greater equity or to solve for inequities, but yet this virtual care space has actually exaggerated. But Jamie, would love your thoughts there. I know I just completely biased the dialogue, but I think that's where you're going.
Yeah, look, I mean, when you take a look at digital health platforms, we get enamored with the technology without thinking about the downstream consequences sometimes of the tech, right? I do think we're at a point in the nation where broadband penetration is at an all-time high, smartphone penetration is at an all-time high, and those things coming together. And we also have a much more like technically savvy population than we've ever had, right, in history.
Yeah.
So from that standpoint, those things bode well for digital health. But just like if you give an artificial intelligence biased data, it's going to be a biased AI, which is a big problem that people are talking about right now. Is like, well, look, if the data that we took in the patient record was taken by someone who might have been a little bit biased, and the data, that we're giving to this technology is going to be biased, we need to be very thoughtful with how we are going to level the playing field for everybody. And as people rolled out COVID, most people were like, can't we just use FaceTime for that? And the answer to that is no. It's not as simple as just adding video, right? And it's not as simple as, the phone is ubiquitous, and people don't realize that that phone call to a doctor can be a really effective form of telemedicine that actually levels the playing field for a lot of people, because most people have access to a phone. And then you start getting into health equity around the homeless population and how you take care of those folks, and where do you discharge these people to now, right? And how you handle all of those types of critical decisions at the point of care. And so it's important as we implement these technologies to really take this stuff into account, so that we can almost, as we're building the new digital health platform of the future, we're not making it a biased platform, but one that actually promotes health equity.
Yeah, because it's fascinating, because you've got a positive correlation between technology and wealth, and a negative correlation between wealth and healthcare. So there's just a macro trend there that you need to be highly aware. And Suzanne, I really loved the point that you were making around like the pushing out of care, or sometimes I see as decentralization. But is that always correlated with digital, or is that happening in different ways that we can be thinking more creatively about?
Whoa, I'm not sure I completely caught the gist of that question, but let me pick up a thread there.
Yeah.
So the digital component, to Jamie's point, I think is what you're getting at. What made me think, what I was thinking when I was listening to him is, yeah, there's a correlation between more technology, better care, right? But one thing that I, at least personally, have been thinking about is, I don't think that digital or technology can replace that doctor-patient relationship. Having a lot of conversation about this, that I don't think telehealth stickiness or remote patient monitoring or anything will stick if you try to reduce relationship that is so important for healing. And so we have, even though we're pushing hard for technology and we're pushing hard for digital relationships with our patients, we're also working under the assumption that there's something magical that happens in that relationship. And so how do we make sure, when we talk about telemedicine or telehealth, how does that just become you lose the term telehealth or tele or in that, and it just becomes healthcare or the practice of medicine with your existing physicians. So really particular around behavioral health. I think that is an area, not anything we're involved in now, but my background is in behavioral health, and it's just interesting to me. I don't think that you're really going to have success in moving to this virtual healthcare model unless you somehow find a way to preserve the relationship part of medicine.
Yeah. And it actually,
by the way, Paul, can I say something really quickly? Because that was almost like a mic drop moment for Suzanne. I felt like, where she was talking about the lexicon, right, that we use, right? When people started using the stethoscope, did we call it stethoscope medicine? Oh, you're doing stetho-medicine. No, we did not, right?
Yeah.
So from that point, like, why are we calling this something that it's really not, and differentiating it from what is just good healthcare, right?
Exactly.
And I actually take umbrage with the word virtual, because when you talk about the word virtual, it's like almost as good as, right? This is better in some instances than in-person care, right?
Yeah.
So for me, it's like, this is just healthcare. It's digitally enabled care, and that's great, but it should be integrated into how the daily practice of medicine for physicians and health systems across the country. And that's really it, right?
Yeah, that's a great point. And a thread that kind of picked up there is around behavioral health, and you have to link that with mental health. And Shruti, it sounded like you had some number of comments, but our first question came in and saying, what's our predictions and prognostication around virtual care, and how we'll evolve to treat those with serious mental health issues? I'd love to get your perspectives on that.
I'm going to go back to the word triage. I really don't think that until we there's so much foundational work that we're working on. And I think right now we're doing really well with telehealth, healthcare at home or what have you, with a lot of basic things. And as those foundations solidify and we get rid of, algorithms that are biased, and making sure that the right people have, phones or TVs or whatever we need to get them where they need to get. I don't know that there's a space there yet for people that are severe anything. I still think those people belong in a different place.
Yeah, that's a great point. Any other comments on that? I think the build there, I've been here, a lot of people are racing in the behavioral health space, the wellness space. The other aspect, and Jamie touched a little bit around this, is their environment. And I think there was an interesting aha moment I had learning about wellness, mental wellness, is those that are in the underserved, underrepresented communities. You might be in a studio apartment with 5 other people. And how do you have a mental wellness checkup phone call when 4 people are sitting next to you, or your wife or your kids? So like, just not even only having the technology and the connectivity, but how is that how are we taking into account those other environmental, socioeconomic aspects around just the digital connectivity to those people?
Mental health is from the standpoint, it's really something that's been stigmatized in society for a long time, right? And that's a shame, because how we feel mentally often manifests itself physically in one way, shape, or form. So for us, like, mental health is the next vital sign. And what we've seen is people at home almost being more honest in their mental health situations than they would have been if they went in person, because there's also this fear of judgment when you're staring at somebody, and you have to build trust and build safety. And a little bit of distance from the digital standpoint actually helps do that to a certain degree. So there have been a few studies that have come out that have shown that people are more honest with an AI, more honest with their computer, and more honest over telemedicine than they might even be in an in-person visit. So I think that, to me, is a big benefit. One of the things that people also talk about is that the doctor or the clinician can actually see that home environment, which actually goes to some of the environmental factors that they would use to actually treat that patient. So, and I think we as patients, we've given up privacy in terms of data and in terms of certain things for convenience over and over again in other industries. We just haven't really done it in healthcare yet. So the real question is, how do all those things come together around mental health?
Yeah. And if you're a words person, I've got a new one for you. Neurodiversity. That's my word of 2021, is
writing
to embrace
it down.
Neurodiversity, because we all got different things in our neurological makeup. Sometimes it's learning differences, sometimes it's a variety of other things, but embracing neurodiversity as we do other aspects has been my word of 2021. Well, I want to bring it down a little bit in the altitude of the conversation to kind of get some tangible stories out for our listeners. But I have to imagine 2020 was a really exhausting year for each of you in your respective roles. But when you look back in that year and you look at the teams that you've been working with and the customers and clients and patients you've been impacting, I'd love to hear kind of a story that really made you proud of what you're working on. And I know, Bree, you've been kind of I had some thoughts there, and I haven't called on you in a bit, so I'll pick on you to kind of kick us off as we think about kind of the things where you kind of saw your organization at its best in 2020.
Yeah, I'll give 2 quick examples. We launched early on our COVID analytics that go out on a daily basis. And we have a team behind the scenes now doing that every single day, because everyone was trying to figure out trends and what was going on, and really to serve our ecosystem, right? They wanted to know what was happening in Italy, so they knew what was going to happen in North Carolina coming up. And so our team did a tremendous job of setting that up, I would say, within 2 weeks, and now have consistently for a year sent that out. And the second was health systems coming to us and saying, help, we are in an integrated health system, and now we can't manage this surge. It was both health systems and states. And so we pivoted our product line in about 30 days, went live, which across 56 hospitals within Florida. We went live with an entire state of Oregon on these analytic tools to let them see where there's surges. And I mean, compliments to the team, just how quickly they went in. We went into 24/7 operation to get that up and running. But that was critical for them, because they could not see their hotspots without 1,000 phone calls, where to transfer people, how to deal with the surge. So both of those things, we're just really proud that we could support our caregivers during that moment.
That's my soundbite of this conversation. You helped integrated delivery networks actually become integrated.
Yeah. Yeah. And that's hard. I mean, that's across, 15 different EMRs and everyone has a different workflow. I mean, it's not easy to do, but yeah,
that's great.
Definitely
That's
a
great.
proud moment.
And Suzanne, you had like a drinking from a fire hose last year with a new bowl and everything going on. I'd love to hear your observations on 2020.
Yeah, well, we were already dealing with, obviously an increase in volume of supplies that needed to get to the home prior to COVID. So about 6 weeks on the job, all of a sudden the fire hose really opened. But what was remarkable to see was we had a couple things. One is we have a bunch of warehouses around the country, obviously, that product from those frontline workers. I don't care who you were in any company, amazing how they stepped up and continued to go in those very fearful days, that March, April, and they still kept showing up. We did have COVID cases. We'd shift around labor, the overtime that those people worked, because there was this commitment that our patients need these supplies. I mean, it's not an option, right? You have to get your diabetes supplies, your pumps, whatever it may be. And then from there, so it was our own warehouses. It was the pressure it put on FedEx and others, and how we had to shift around our warehouse distribution products. So things would, if we couldn't ship it from Texas one day to someplace in Texas, it would come from North Carolina and show up the next day. There's no excuses, both on behalf of the shipping companies and our own. And then the supply chain this past year, as you've probably seen in all the newspapers, is just a mess. Empty containers all over the world, Suez Canal, you name it. So trying to maintain a organized supply chain through this COVID period to support our hospitals and our at-home patients has not been an easy task.
Yeah.
And so a lot of logistics behind the scene. Our costs have obviously gone through the roof as a result. We have not passed that on, obviously, knowing that we will right size all this, but heroic efforts by everyone involved in any company providing supply chain to the healthcare industry this year.
Yeah, no, and it's been great. I think there's been a number of new deals and relations that Cardinal's been putting in place as we go into 2021. But I think you really appreciate the role that Cardinal plays in the U.S. healthcare system, because when an organization that size shows up at their best, you really see it and you feel it, and that shouldn't be undervalued. That was great to see.
Yeah, and obviously, I think it also it shed some light on how supply chain companies could do better, and how hospitals and even state governments could improve for the next whatever it may be. I think, as good as it was that we've reacted, it was a lot more responsive than proactive. And so I think COVID has taught industry a lot about how to be better prepared for the next COVID-like situation.
Yeah, it was interesting watching. I think it's great having both Suzanne and Bree on the call. It's like, okay, there's a pandemic going on. What's going on? How do we know what's going on at a national level? And a lot of the stuff that GE was kind of publishing was just able to harness a lot of data that you really can't see what's going on at a national level in the U.S. healthcare system, and you can't move the supply chain around. It's in provinces and states and local, and it's kind of scary how, if you actually have to act on a pandemic in the future or any health crisis, how little control anybody has in rapidly reacting. Right. Sorry, Bree, you want to comment?
No, go ahead. I just
okay,
agree.
That's fine. But Shruti, we'd love to get your perspectives in terms of look back in 2020. What were you most proud of with your team and your organizations, as I know you work with a number of them?
Well, I was going to just start by saying, what I heard listening to Bree and Suzanne was just collaboration, and how important that was to them and their teams, and sort of it not being about just the company. Like I heard Suzanne say that multiple times. It wasn't just us. It wasn't just us. And yeah. I just think that's amazing. And first choice is in Seattle. So if y'all remember, that's a little bit of where everything started. And so they just, I think it came down to just reacting so quickly to what what are the needs of our members and our clients? And I think that's where it really starts. How can we help the people that need it? And for them, it was really just getting in a lot of systems in place for people to be able to for them to get telehealth and text-based health and everything that they needed easily. Because in the end, all of these things were actually available before COVID. I sometimes definitely forget that. They were all in place. I think really what happened was, how do we make it so that we can change behavior? We can make these things readily available at people's fingertips, and let's make them free. And I think that's where I'm really proud of First Choice.
That's great. That's great. And Jamie, you never had a dull moment last year as well. Would love to get your perspective. Yeah.
No, we certainly didn't. But you know what? In listening to Trudy and Suzanne and Bree, it's pretty amazing when you think about, to think about GE launching a product in 30 days, like, blows my mind, right? Because of all the legal review that needs to get done and everything that needs to happen for a company like that to be able to do it. And it's amazing to see these large companies like GE and Cardinal behave like startups and be able to add so much value to that client base so quickly, right? Like, I just know our company is obviously smaller and we pride ourselves on being nimble, but damn, Bree, that's impressive. Like, it's like, you guys should take a lot of pride in that. And it's pretty great. So from our standpoint at Cloudbreak, and by the way, Suzanne, we have a big operation in Columbus too. So, go Columbus from that standpoint. We use this opportunity to really accelerate our product roadmap, because we tracked what hospitals tracked. Like, people didn't realize, and Trudy just alluded to this, telemedicine was alive and well pre-COVID, but it was alive and well in the hospital, right? We had telestroke, we had telepsych, we had tele-ICU, like all these different specialties who were collaborating around the patient in hospital. And what COVID really did was launch that adoption into the consumer marketplace. But for us, when we saw the first COVID wave happen, like, it decreased our number of encounters on the platform. And everyone's like, well, it's COVID, you guys should be crushing it right now. And I'm like, actually, no, that's not what happened. And we used the opportunity to lock arms with our health systems and to create new services for them. And one of the things that come to mind is our telequarantine platform. So we said, well, geez, we have 14,000 video endpoints in the field. Can we use that to turn any room into a connected care room? And therefore, the doctor doesn't need to go in around on the patient, and they could then reduce their use of PPE, reduce the that risk of contagion. We could protect frontline healthcare workers. And that system was adopted by 27 healthcare systems overnight, doing thousands of encounters over the course of the next few months over the platform. And for us, like, that was amazing. And one of the encounters that I remember very directly was, there was a mom who was giving birth. She only spoke Spanish, and she gave birth and she was COVID positive. So the first thing they do is take your baby away, and the baby goes to the NICU. The mom for 5 days wasn't able to speak to her patient. And all of a sudden the health system said, you know what, we have Cloudbreak's platform. Let's roll the iPad in, put it on top of the incubator, and let mom speak to her child. And immediately, like, the baby started reacting. And then she was also able to bring in an interpreter so that the doctor could then speak to the mom, right? And these are the things that people don't think about, but that for us was like, our work here is done, right? This is the type of use case that we've dreamt of the platform being used for. And it was really gratifying to see that happen at health systems across the country.
That's
Yeah, I would
awesome.
say it's similar, Jamie, on that. I think COVID kind of focused, like, it took what you had in the foundational one, focused you on different problems. And I think that also opened our eyes to, wow, we can do a lot more than we even thought we could do. And you find these niche use cases, I mean, through, unfortunately, a crisis situation, but kind of also probably a proud moment for you to say, look how quickly we can pivot to different use cases, and opens up kind of a world of different opportunities, going forward, I'm sure, on your roadmap.
Yeah, I mean, we launched that product in 2 weeks. And for us, I think the thing that was amazing about COVID, right, and Bree just talked to this, like, it galvanized the entire organization around a single purpose.
Yeah.
And it really brought out the best in everybody. And I kind of want that to continue. Like, I don't want to go back to the way that things were and having to worry about all the things that we were worried about before, because it was so cool for everyone to lock arms and work around this sole purpose. And, we offer that platform for free to the market. Because we're like, this is just the right thing to do. And I love that part of being an entrepreneur. Like, we were put on this earth to solve these types of problems for people.
And in the spirit of all the good things that, I think will come from this, Bree, like you said, it definitely shed light on where healthcare is over complex or too complicated. So for example, like,
Oh,
of their prescription and the frequency of that. Are you losing me?
Yeah.
I lost you for a second. Just restart. You're good now.
Okay. And so what I was saying was has exposed the complexity of healthcare. And so what we're trying to look at is, the example I'll give is a diabetic who has to get, and I may get the time wrong, but every 3 months, a renewed prescription. I couldn't go to their physician. So there was some regulatory exceptions put in place, but I was speaking to a long-time diabetic patient of ours, 57 years diabetic. And he says, I don't need to go to the doctor every 3 months to just get my prescription renewed. Now, think about it from a patient perspective, but think about it from our perspective, every 3 months, we've got to get that prescription. Then we've got an insurance carrier, and there's all kinds of complications in there, and it may delay getting the supplies to the patient's home. And so how do we continue to streamline this at-home care from a reimbursement regulatory perspective so that you take cost out, but you also provide a more continuous care for the patient?
Yeah. That's been a huge breakthrough. Like even this.
But a lot of regulatory requirements, a lot of the reimbursement and regulatory requirements were built on getting that patient to the office, and we have to stop that type of thinking.
Yeah, that was a huge breakthrough. Just even in my personal story, is my sleep medicine provider. I remember being aggravated because we forget that's one appointment, but for us, particularly for busy professionals or those that live in the large metro area, a few care points, when I have a doctor's appointment, that's half my day of travel there, waiting, travel back. And I remember asking him, going, this is just a checkup. All my stuff's digital. You look at a dashboard, you say, great, you're renewed. Can I do this virtually? They go, yes, we offer that, but your insurance doesn't cover it. And just like watching just the silos of healthcare converge finally to alleviate some of those. Now my last year's checkup was 5 minutes in my day, opposed to a half a day. But that's really what's great to see. Even in 2019, I was at a large health system doing lots of internal interviews with some of the different pockets of the organization. And the vice president I was walking around with, it came up a number of times and goes, well, we really react and are great in a crisis. And to which the vice president says, why does it take a crisis for us to actually do the right thing? But you get a sense of the misaligned incentives and siloedness of even a single healthcare organization, let alone an entire system coming through life here. Yeah. The power of purpose. Would love to flip that now. And then, knowing how exhausting 2020 was, if you could go back and meet your 2018 or 2019 self, what advice would you give them? Jamie, I might pick on you first since I've been rounding it out with you. I'll have you lead.
What advice would I give them? Imagine a global pandemic is possible. Imagine that amidst political instability and racial injustice that you can actually accomplish great things, right? There's so much that we were all challenged with during the course of the last year and a half. And again, what really galvanized us at Cloudbreak was coming together around these issues, right? I can tell you that from a DEI standpoint, we're a very progressive organization. You can imagine that having language interpreters from 50 different languages across the platform, they have different races, faiths, beliefs, all those different types of things that operate to the point where we don't really have a Christmas luncheon. We have a celebration of success and we celebrate everyone's accomplishments. But what we realized as a business was that was very different than being a diverse company and having that be part of our cultural DNA. So when it comes to these types of things, we focused on the fact that diversity is a strength. And I would have been focusing on that a heck of a lot sooner as part of our organization so that we would have been prepared to take on some of these challenges that we all faced over the last year or year and a half. And that goes to product and it goes to customer service and it goes to everything that we do as an organization. And now that it's ingrained in that DNA where, the organization is 10 times better off.
Awesome. Others, I'll let go. Whoever wants to go next, chime on in.
Mine is probably pretty slow. I would have expanded our warehouse capability. I would have invested more in technology, and I would have already started to shift the workforce home.
Succinct. I love it. Bree, what are yours?
I think just to stay focused, we chase quite a few shiny objects. I mean, we're within GE Healthcare, but we are a startup within GE Healthcare, and it's easy at that point to chase a lot of different things and try to serve, you know, everyone in a different way, and it's just not scalable. So I think we also use the pandemic to refocus us and recraft what we really wanted to be when we grew up. And I would.
Oh,
I'd say in 2018, man, just leave those shiny objects. We did a lot of time and energy in some of those areas. And then I think, man, I wish I had better strategies for, is my internet okay?
yeah, you're coming
Okay
through.
now.
Do you guys hear me okay?
It's managing, yeah.
Okay, sorry, I just got an alert. My other thing was I wish I would have had better strategies in the moment. We have a team who's normally on site all the time. And so when they went virtual for a year, man, it was tough on the team and we were not prepared for it. We didn't know how to move to keep the team bonding up and all that other stuff that's so important in the culture. I think we're still working on that. And so I wish I would have had strategies in 2018 to prepare for a remote workforce and how that changes your culture and the things you need to do to take care of your team, who's ultimately taking care of your customers. So that would be my second learning.
That's great. Shruti?
So, I mean, definitely everybody kind of hit on some major things. And I think I would just add, I wish I really understood how important our school systems were and how integrated they were with work and health. I tell you, that's probably the biggest epiphany I had last year. I've always, thought teachers were just amazing, but it really hit me in this last 12 months, just how much integration there is between what they provide us and the public, our children, the ability to work and get things done and create. So I just wish I would have realized that prior to, COVID.
Yeah. I love how it just let people be people. If we all just step out of like the panel conversation, but it's just like, oh, I'm a partner and a dad. Here's my kid in some of that conference calls. It's what we do the other half of our lives. It doesn't have to be like walled off and be interrupted by your family in the background, pretending as if I don't have a family. That was kind of a weird myth that we lived prior to the pandemic, that your work life and personal life were just things that never crossed. Like, no, it's the same person. And I think recognizing all that interdependencies with teachers and schools and everything else that make up our lives, that became very real and very authentic. And I think in a hard listen, but in a good way. Okay, well, I'll turn over to some Q&A here for the last 10 minutes of the call. One question is, as the pandemic subsides and you zoom out and you look at the different companies that are playing anywhere, who's coming out ahead? When you look at 2019 and then skip to 2021, who just leapfrogged or moved higher on the rank, whatever that rank might be. But essentially the question is, as the pandemic subsides, which companies are coming out ahead?
And it's that, I assume that question is from a healthcare perspective.
Yeah, from a healthcare perspective, healthcare organizations, which ones are coming out ahead? I'll just take it at face value.
Yeah. So the one, I mean, the obvious, I think there's some obvious tech players that'll yet to be seen, but what I've been impressed by is the actual hospital systems are pushing out healthcare into and what I mean by that is the old ways of hospitals trying to hold on to census in the actual hospital setting, I think we'll lose. Yeah. And I think that the hospital systems, to name a few, Mayo Clinic or Kaiser Permanente, who are really focused on how do we take care of people in the community and only the most acute in the hospital setting, I think they will win, and they will have a big say in who will become other healthcare winners, because they'll pick and choose those players that are helping them do that. I think it's naive to think that healthcare really doesn't, it all starts with the acute world, I think, still. And so as they go and the technologies that they adopt and the pace at which they move to community care will dictate which players win.
got a few people in the audience from Kaiser, so I'm sure they are happy to hear that. Others?
I think I'll take another bent on what Suzanne is saying, which is that I think local healthcare wins, right? At the end of the day, I think people want to be part of a local healthcare continuum where they want their existing care continuum to be enabled with digital health tools. They don't necessarily want a new care continuum coming out of left field and be seen by a doctor in New York if they live in California. They want, they want to have their longitudinal patient record so that the doctor has their full information. There's always going to be a place for episodic care, but I think we're moving much more to this continuous care model, and healthcare systems who have built their digital front door, who post-discharge are following up with telemedicine. I think, the concept of healthcare moving beyond the four walls of the hospital and becoming decentralized, absolutely happening. More care in the community, absolutely happening. And it's a huge opportunity for these local healthcare systems to really plant a flag on building a relationship that goes beyond the in-person visit, which typically the whole system has been built around.
Shruti, I would love your reaction to that
And
as a local player.
Well, so a couple things. I think the people that are going to win are the ones that aren't trying to put a square peg in a round hole. I mean, I think the issue that we've had over the past pre-COVID years is we were trying to take what we already had and just make it virtual. And that's not the answer. The answer is starting over. How do we make this the best it can be? And again, as we all keep saying, this is our time. This is our time. We've been given all these things in 2020. Let's look at a silver lining and move forward. In terms of the local community, that's like in my head all the time, Jamie. I think I mentioned to Paul, pop health has always been about what's happening in the country. It needs to start being about what's happening in your community. Don't treat me like you would treat somebody. If I'm in Atlanta dying of allergies and I've got a cough and a runny nose, don't treat me like somebody who's sitting up in like Alaska with snow and probably, so it's kind of like understanding what's happening in my zip code and going from there. So I fully agree with what Jamie was saying.
I think the providers that figure out a way to use this to transform the care model, we've had the same care model for 50 to 80 years, the same old thing.
Mm-hmm.
We have to transform. We've got to use this pandemic to do it. I think that's going to be very hard for these health systems to do, but those who can really say, what is the new delivery model? Ignore what we did in the past are the ones going to get ahead. I mean, it's just not sustainable. Their margins aren't high enough to deal with it. The sicker population, someone's got to do a big shift. It can't just be, let me get incrementally better for the next 10 years. I just don't think those health systems will survive.
Great. And Suzanne, you're going to chime in there just a moment ago.
I think everyone hit on it, but this underlying theme of the economics of healthcare, I mean, we all love to talk about the clinical aspects, right? Like safe, effective, high quality or equivalent, but also those companies that look at it from driving out cost.
Yeah.
We've always talked about economic value proposition in healthcare, but I think if we're really going to rewrite it, like we're talking about this opportunity that we have, the companies that have figured out how to take cost out through technology, I think will be the big winners.
That's an excellent point. I'm noticing this kind of goes back to the health equity piece and the logical how to run a fiscally responsible business. To Bree's point, I'm seeing a lot of my clients talk about how we're going to focus on health inequities, and the next conversation going, well, we need to focus on this payer mix or that payer mix. Like as soon as you start focusing on payer mix, you're immediately shooting yourselves in the foot. But Suzanne, to your point, if you're able to reduce the cost piece and you're able to figure out the margin play for all patient populations, which is a high altitude kind of conversation, it's going to be better for our, but just trying to, there's a lot of competing priorities that we need to wrestle through here for sure. And cost, I think, is one that we can all focus on. Awesome. Well, this has been a great conversation. I walked away with a number of great takeaways. I think one is stop calling it virtual care versus just it's the future of healthcare or the better way of doing care. This decentralization or pushing care out and no longer having this kind of campus hub and census-based type of healthcare was a great piece. And I think also noticing the importance of purpose and cultural alignment, because I think we found out how patient-centric we were last year. Of all the companies I see with mission statements about how patient-centered they are, and you actually saw it show up last year, which means how unpatient-centric they weren't prior to that. So having a good purpose and making sure that we're aligned around that, which is great. But Bree, Jamie, Shruti, Suzanne, thank you so much for joining the conversation. Really appreciate it. And thank you for everyone in the audience that's lobbed in questions throughout the conversation. We hope you enjoyed it as well.
Thank you.
Thank you.
Thank you and have a great day. Bye.